The sterile air of her 3 hung thick with a metallic tang and the acrid smell of fear. 12-year-old Zara Hussein, tiny and frail, lay unnaturally still on the operating table, her small body convulsing with each failing pulse. A blossoming crimson stain spread across the pristine surgical drapes, mocking the frantic efforts of Dr. Zoltan Kovacs. Usually an immovable titan, the chief of surgery barked orders laced with escalating panic as standard procedures worsened the hemorrhage. More pressure. Suction. Damn it, we're losing her, he roared, his brow beaded with sweat, his renowned expertise failing him completely. A cold dread began to seep into every heart, knowing Zara's fragile, unique venous structure was disintegrating under their very hands. Her life, already a testament to silent struggle, now faltered precariously. At the periphery, Nurse Luz Garcia watched, her gaze intensely focused on the monitor, on Zara's fading life. No one noticed the quiet spark in her eyes, the flicker of a hidden understanding. They saw only a rookie nurse, but beneath her unassuming facade, a different kind of knowledge, honed in forgotten battlefields, stirred to life. Zara was dying, but Luz knew a secret, a gentle way to mend what others broke, a way that defied everything Dr. Kovacs believed possible. The operating room at Grandview Medical Center wasn't just a sterile space, it was a cathedral of medical dogma, presided over by titans like Dr. Zoltan Kovacs. Now, that cathedral was a storm-tossed ship, its captain losing his bearings. The sterile white walls, usually a canvas for precision and control, seemed to press in, mirroring the escalating panic in the room. Dr. Kovacs, celebrated for his surgical prowess, was a man undone. His movements, once balletic, were now frantic, his brow perpetually furrowed, sweat trickling from his temples despite the frigid air. "Damn it, where's the bleed?" he roared, his voice cracking with a frustration that bordered on despair. Every clamp he applied, every suture he attempted, seemed to tear through Zara's delicate vessels like paper, worsening the hemorrhage instead of staunching it. The standard procedures, the ones he had perfected over decades, were not just failing, they were actively harming the little girl. A junior resident fumbled with a suction catheter, his hands trembling visibly under Kovacs's furious gaze. Another nurse, usually unflappable, swallowed hard, her eyes darting between the monitor's plummeting numbers and Zara's fading form. This was not how things happened at Grandview. Failure was an anomaly, rarely witnessed, never indulged. Luz Garcia, barely a year out of nursing school, felt the stark weight of the hierarchy pressing down on her. Her place was to anticipate, to assist, to silently observe. But what she was observing was terrifyingly clear. The conventional methods, aggressive and blunt, were tearing Zara's unique, fragile veins. It wasn't just the bleeding, it was the way the tissue around the vessels seemed to disintegrate at the slightest pressure, a structural weakness that spoke of a deep, almost ethereal fragility. Her combat medic training, honed in the chaos of improvised field hospitals, screamed at her that this required an entirely different approach, one born of gentleness, not force. As Kovacs barked for another, tighter ligature, his voice a desperate snarl, Luz's voice, a small tremor in the cavernous room, broke the charged silence. "Doctor, the tissue here seems exceptionally friable. Perhaps a less aggressive approach for vessel integrity?" Her words were carefully chosen, a suggestion framed as an observation, a soft inquiry rather than a direct challenge. It was the only way a rookie nurse could speak to the chief of surgery without inviting immediate censure. Kovacs froze, his hand hovering over Zara's exposed abdomen. He slowly turned, his eyes, usually sharp and penetrating, now clouded with a volatile mix of panic and indignation. His glare was a physical blow, pinning Luz in place. "Nurse Garcia," he bit out, his voice low and laced with menace, "I commend your enthusiasm, but I believe I am the chief of surgery. Your role is to pass instruments, not to diagnose vascular conditions. Stick to your charting." The dismissal was absolute, humiliating. A ripple of suppressed discomfort passed through the other staff, but no one dared to intervene. The message was clear: stay in your lane. Luz felt a flush creep up her neck, but her gaze never wavered from Zara's pale face. Her heart hammered against her ribs, not from embarrassment, but from a growing dread for the child on the table. Kovacs, his ego momentarily appeased, turned back to the gaping wound, doubling down on his failing strategy. He continued to try, his movements growing more desperate, more forceful, the very opposite of what Luz knew Zara needed. Each failed attempt, each renewed gush of blood, was a testament to his expertise faltering, but also to his profound inability to adapt. A mournful, steady bleat from the monitors began to punctuate the silence, a rhythmic dirge to Zara's fading life. Her complexion, already pale, had taken on an ashen, translucent quality. The slight rise and fall of her chest grew shallower, more desperate. The room, already tense, now hummed with a quiet, sickening dread. Everyone knew what those sounds meant. Zara was bleeding out, slowly, inexorably, under the very hands of the man renowned for saving lives. And the rookie nurse, the one with the flicker of hidden understanding in her eyes, was being forced to watch, silenced by the very hierarchy designed to protect. The mournful bleat from the monitors had escalated into a rapid, frantic rhythm, a percussive countdown to disaster. Zara's heart rate, once merely concerning, was now a mere whisper on the verge of silence. The blood, which Dr. Kovacs still struggled to contain, seemed to mock his every effort, pulsing weakly but relentlessly from the internal wound. He had moved from focused intensity to a frenzied, almost brutal desperation. His hands, once surgically precise, now moved with a clumsy urgency, each movement a testament to his expertise faltering under extreme pressure. Luz, pressed against the back wall, felt a tremor run through her. Her eyes, usually soft, had sharpened into an almost predatory focus. She wasn't just observing, she was dissecting, processing, feeling Zara's condition. Each time Kovacs's instruments moved, she winced internally. He was attempting to ligate, to clamp, to cauterize, using standard, aggressive techniques for a standard hemorrhage. But Zara wasn't standard. Her veins, weakened by her underlying condition, were not responding. Instead of sealing, they were tearing, fraying like ancient parchment under the assault. Luz saw the dark, bruised tissue around the attempted ligations, clear evidence of the delicate vessels collapsing under normal pressure. It was a critical error, repeated again and again, born of a brilliant mind incapable of adapting to an unprecedented challenge. More suction. Kovacs barked, his voice hoarse with exertion and rising panic. He wiped a bead of sweat from his brow with the back of his gloved hand, smearing his protective eyewear. "We're losing too much volume." The anesthesiologist, Dr. Anya Sharma, spoke with a strained voice, BP dropping. "Doctor. Pulse is thready. She won't tolerate much more." A shudder ran through the room. Zara, 12 years old, frail, and now impossibly pale, was fading before their eyes. The soft rise and fall of her chest had become almost imperceptible. This wasn't just a surgical emergency anymore, it was a slow, agonizing death unfolding in real time. Luz's own breath hitched. A cold, sharp certainty cut through the fear. She recognized the pattern, vessels that refused standard repair, bleeding that only worsened with conventional intervention. It wasn't a medical school case study, it was a ghost from her past, a visceral memory of dusty fields and makeshift clinics, of young bodies ravaged not by disease, but by sudden, violent trauma, where traditional methods often failed or caused more harm. She recalled the almost impossible delicacy required, the unorthodox improvisation, the desperate measures she'd had to invent to save lives when conventional medicine was miles away. Her hands, hidden within her sterile gloves, flexed involuntarily, almost feeling the unique give of those fragile veins, remembering the precise, feather-light pressure, the specific angles. "Dr. Kovacs," Luz began, her voice barely a whisper, yet it cut through the din of monitors and frantic commands, carrying an uncharacteristic edge of urgency. "Her vessels, they're extremely fragile. The pressure, it's tearing them." Kovacs paused, his head turning just enough to glare at her over his surgical mask. His eyes, though obscured by sweat-streaked glasses, conveyed a seething impatience. "Nurse Garcia, I am aware of the patient's condition. This is not the time for amateur diagnoses. Focus on your instruments." He waved a hand dismissively, turning back to the wound, his movements even more desperate now. He was proposing a more invasive, desperate measure, a deep exploration into the abdominal cavity, a move that, in Luz's expert opinion, would surely be the final, fatal blow to Zara's already stressed system. As Kovacs reached for a larger retractor, ready to force his way deeper, a long, piercing shriek erupted from the monitors. Zara's heart rate had vanished. The single, flat, continuous tone filled the room, a death knell. "She's flatlining," Dr. Sharma cried, her voice cracking with pure terror. "Cardiac arrest." A collective gasp swept through the OR. Kovacs froze, his hands hovering uselessly above Zara's opened abdomen. The air crackled with raw, unadulterated fear. Zara, the disabled girl they were supposed to protect, was gone. The weight of human life, so delicately balanced, had just tipped into the abyss, leaving behind only the chilling silence of a flat line and the unspoken question, "What now?" Isn't it incredible how often true genius is found in unexpected places, and how easy it is to overlook the quiet hero? If Luz's journey resonates with you, that feeling of being underestimated, then you're already part of our story. We warmly invite you to officially join our growing global community. Your subscription isn't just a click, it's a vital part of helping us bring you more powerful, heartfelt narratives where the overlooked find their moment. Let's celebrate these unsung heroes together and build a channel full of inspiring tales where every voice matters. Thank you for being here. The long, mournful wail of the flatline severed the last threads of hope. It echoed in the pristine, sterile theater, louder than any scream, colder than any ice. Zara's heart rate was a zero, her breath a memory. Dr. Kovacs, usually a figure of commanding authority, stood frozen, hand still poised uselessly over the small, opened abdomen. His face, usually a mask of professional calm, was now a portrait of utter devastation. Failure. Catastrophic, irreversible failure. The other surgical staff, Dr. Sharma, the anesthesiologist, the scrub nurse, were equally paralyzed, their gazes fixed on the monitor, then on Kovacs, then back to the lifeless form of the 12-year-old girl. A child, robbed of her already fragile life by their inability to save her. For Luz, the sound was a jarring plunge back into a past she had fought to bury. It wasn't the sterile beep of a hospital monitor, but the agonizing silence that followed a battlefield explosion, the sudden, terrible void where life had just been. Her combat medic instincts, dormant beneath layers of humility and protocol, surged forward, raw and undeniable. She saw Zara, not as a complex medical case, but as a wounded soldier, fighting for every precious breath. And Luz knew, with a certainty that transcended fear, that she still had a chance. She had a chance. A tremor ran through Luz, not of fear, but of the monumental risk she was about to take. Every fiber of her being screamed against it, the rigid hierarchy of Grandview Medical Center, the scorching wrath of Dr. Kovacs, the potential career suicide, the shame of failure. She was a rookie nurse, standing amidst titans of medicine. But then she looked at Zara, her small chest unmoving, her young life slipping away before their very eyes, and the tremor solidified into an unyielding resolve. The rules, the fear, the protocol, they evaporated in the face of absolute urgency. A deep breath, drawn from a wellspring of forgotten courage, settled her. Her eyes, which moments before had held quiet observation, now blazed with a fierce, unwavering focus. Her hands, usually deft in their nursing duties, steadied with the phantom weight of battlefield instruments. The transformation was startling, instantaneous. The humble rookie nurse vanished, replaced by the ghost of a combat medic, honed by fire and driven by an absolute refusal to let life be extinguished prematurely. No! The word ripped through the suffocating silence, surprisingly loud, surprisingly clear. It was not a plea, but a command, echoing with an authority that stunned everyone, including Luz herself. All heads snapped towards her. Kovacs, slowly lowering his hands, turned, his eyes, still glazed with shock, narrowing in bewildered anger. "Nurse Garcia? What did you say?" His voice was a dangerous rumble, laced with incredulity and the nascent spark of fury. No one, absolutely no one, interrupted him, especially not at a moment of such profound failure. Luz took a step forward, her voice gaining strength, each word a defiance of the protocol she was shattering. I said, no. She's not gone. She met Kovacs' furious gaze head-on, her own gaze unwavering. Dr. Kovacs, your methods are too aggressive for her unique vascular structure. You're causing more damage. I know a different way. A gentle one. A collective gasp swept through the remaining staff. Dr. Sharma's eyes widened to saucers, her hand flying to her mouth. The anesthesiologist looked as if he might faint. A nurse, daring to correct the chief of surgery, who had just pronounced a patient dead. It was unheard of. Kovacs' face flushed scarlet. The shock of Zara's flatline quickly morphed into raw, offended pride. Nurse Garcia, he bellowed, his voice echoing with unchecked rage. This is my operating room. You are a nurse. You will not question my judgment, and you certainly will not interfere. He jabbed a gloved finger towards her, his anger palpable. Get back to your station, immediately, or you're dismissed. But Luz didn't flinch. Her feet were rooted to the floor. She's dying, Dr. Kovacs, she retorted, her voice rising, cutting through his bluster. And you don't know how to save her. But I do. The words were a gamble, a desperate, final throw of the dice. She was burning her bridges, risking everything. But Zara's still form was a more powerful motivator than any fear. Her veins are like spun glass. You need finesse, not force. I have a technique. It's unconventional, but it will work. Kovacs stared at her, his chest heaving. His first instinct was to have her physically removed, to silence this insolent, insubordinate nurse. But then his eyes flickered to the flatlined monitor, to Zara's still face, to the blood that still seeped, albeit slowly, from the open wound. He had failed. He had truly, irrevocably failed. And Zara was dead. Or nearly dead. Desperation, cold and hard, began to chip away at the fortress of his ego. What was left to lose? His career was already on the line. The child was already gone. A long, agonizing beat of silence stretched between them, thick with the weight of unsaid things. The whole room held its breath, suspended between absolute despair and a flicker of impossible, irrational hope. Kovacs' eyes, wild with despair, darted between Luz's defiant stance and the merciless monitor. He saw not a nurse, but a force of nature, radiating an inexplicable confidence amidst chaos. Finally, the words were torn from him, raw and choked with humiliation and a primal terror of defeat. Fine, he rasped, his voice barely a whisper, yet loud in the deathly quiet. His gaze, however, was icy, menacing. But if she dies, if you make this worse, you will never work in medicine again. Do you understand? Luz nodded, a single, decisive dip of her head. No hesitation. No fear. The gauntlet was thrown, and she had picked it up. The transformation was complete. The chief of surgery had relinquished control, not to another surgeon, but to a humble nurse, a woman who now stood on the precipice of either miraculous salvation or utter professional ruin. The oar, once defined by Kovacs' authority, now hung on Luz Garcia's courage. The moment Dr. Kovacs' shattered fine hung in the air, something in Luz Garcia snapped into place. The trembling in her hands vanished. The fear that had been a tight knot in her stomach unwound, replaced by an astonishing clarity, a cold, sharp focus she hadn't felt since the sands of war zones. Her posture straightened, no longer defiant, but resolute, almost regal. It was as if a switch had been flipped, transforming the humble nurse into something utterly formidable. Scalpel, she stated, her voice calm, utterly devoid of the tremor that had plagued Kovacs only moments before. She didn't shout, didn't demand. It was a simple request, yet the authority behind it was absolute, silencing the last vestiges of panic in the room. Her eyes, no longer pleading, swept over the surgical team, fixing each one with a gaze that brokered no argument, only immediate, precise execution. The scrub nurse, startled, fumbled to place the instrument in Luz's outstretched hand. Luz didn't take it. Instead, she gestured. Smaller. finer blade, and a single loop of microsuture, 5/0, without a needle. Just a thread. Dr. Kovacs scoffed, a dry, incredulous sound. Microsuture without a needle, nurse? What exactly do you intend to do, knit her a sweater? The sarcasm was brittle, a last-ditch effort to reclaim some semblance of control through derision, but it lacked its usual sting. He watched her, bewildered, a predator temporarily disarmed by an unexpected prey. Luz ignored him. Her attention was solely on Zara, whose small body was barely clinging to life. She leaned closer to the open cavity, her brow furrowed in concentration. Her vessels are like spider silk, Doctor. Frayed, delicate. Every conventional stitch, every clamp, every attempt to cauterize, it tears them further. It's like trying to mend tissue paper with a hammer. She looked up, meeting Kovacs's bewildered stare. We need to coax them closed. Not force them. The blood isn't gushing from a major artery, it's weeping from 1,000 microtears in a compromised venous system. We have to be gentle. Invisible. A stunned silence descended. Coax? Invisible? The other doctors exchanged glances, their faces a mixture of confusion and open disbelief. Dr. Anya Sharma, the resident who had initially dismissed Luz, leaned forward, her skepticism palpable. Nurse Garcia, what precisely are you proposing? Luz held out her hand. The microsuture. And a pair of fine, non-toothed forceps. The ophthalmic kind. The scrub nurse, now moving with a newfound, almost fearful efficiency, produced the requested items. Luz took the tiny loop of suture thread and, to the astonishment of the entire OR, began to meticulously, delicately tease apart the fibers of the thread. She was unraveling it, creating an even finer, almost invisible filament. Her fingers, strong yet incredibly nimble, moved with a balletic precision that captivated every eye. This isn't about conventional ligation, Luz explained, her voice low, measured, as she prepared her improvised tool. It's about capillary stabilization. Using the body's own natural clotting mechanisms, but giving them a framework. I learned this technique where resources were scarce, and the patients were often too fragile for aggressive intervention. Her eyes flickered to Kovacs, a ghost of a challenge in their depth. Like Zara. She positioned herself, taking a deep, calming breath. The air in the OR, which had been thick with panic, now thrummed with a different kind of tension, one of intense, almost fearful anticipation. Every gaze was fixed on Luz, on her quiet, focused intensity. Kovacs, though still deeply skeptical, found himself unable to tear his eyes away. He watched as she leaned over Zara's tiny, exposed form, her concentration absolute, her face a mask of serene determination. And then, she began. She wasn't cutting, wasn't clamping. With the fine forceps, she meticulously identified the most compromised areas of the vessel walls, and with the impossibly fine filament of suture she had created, she began to, almost imperceptibly, weave it around the leaking capillaries. It wasn't a knot, not a stitch in the traditional sense. It was a delicate, almost artistic realignment of tissue, a whispered promise of closure. The doctors watched, mesmerized. It was agonizingly slow, excruciatingly precise. It defied everything they had been taught, yet the quiet authority emanating from Luz, the sheer confidence in her every-minute movement, held them captive. A faint, almost imperceptible sheen of sweat broke on Kovacs's forehead. He was still the chief of surgery, but in this moment, in his own OR, he was nothing more than an observer, a witness to a procedure utterly alien, yet strangely compelling. The question hung unspoken in the air, could this actually work? The clock in the OR seemed to cease its march, every second stretching into an eternity. Luz, oblivious to the world beyond the minuscule landscape under her gaze, continued her impossible dance. Her breathing was shallow, controlled, each exhale a silent prayer, each inhale a renewed focus. The delicate filament, almost invisible, glimmered under the surgical lights as she made her final, most critical pass. It wasn't about strength, but about finesse, about understanding the inherent fragility of life itself. And then, with a subtle shift of her wrist, a movement so precise it was barely perceptible, her hand stilled. She didn't announce it, didn't make a grand gesture. Her fingers, which moments ago had been a blur of controlled motion, simply rested. Her eyes, still intensely focused, slowly lifted from the magnified field. A pregnant silence descended, heavier than the very air in the room. Every breath was held, every muscle tensed. Dr. Kovacs, who had been leaning forward, almost imperceptibly, now froze, his eyes glued to the monitors, then to the surgical site. The suction nurse, her hand poised, waited, her gaze darting between Luz and the incision. And then, it happened. A single, distinct, rhythmic beep. Then another. And another. The steady pulse of the cardiac monitor, which had been a frantic, erratic stutter just minutes before, now resonated with a strong, unwavering rhythm. The anesthesiologist, Dr. Sharma, a woman usually unflappable, let out a shaky gasp, her hand flying to her mouth. Pulse, strong and steady, she whispered, her voice thick with disbelief and a nascent hope. Blood pressure stabilizing, oxygen saturation climbing. The blood, which had been welling up relentlessly, obscuring the field, had stopped. There was no gush, no dramatic cessation. It simply wasn't there anymore. The deep, crimson pool that had terrified them all was receding, replaced by the clean, exposed tissue. It was as if an invisible dam had been built, not by force, but by a whisper of persuasion, guiding the flow back to its proper path. A collective sigh, deep and guttural, rippled through the operating room. It was not a sound of triumph yet, but of sheer, unadulterated relief. Shoulders slumped, tension bled from stiff postures. Some nurses openly wept, their faces streaked with tears of release. One scrub tech dropped a tray with a clatter, but no one flinched, the sound was absorbed by the palpable wave of emotion. Dr. Kovacs stood utterly still for a long moment, his formidable presence momentarily deflated. His eyes, usually sharp and commanding, were wide, reflecting a profound bewilderment that was slowly giving way to something akin to awe. He looked at the surgical field, then at Luz, then back at Zara's monitors. The little girl's pallor, so alarming just minutes ago, was subtly improving, a faint, healthy pink returning to her lips. He walked slowly towards the table, his steps heavy. He peered into the incision, his brow furrowed in concentration. He saw it, or rather, he didn't see the gushing. He saw the microscopic, delicate weaving, a testament to a skill he couldn't even comprehend. He reached out a gloved hand, hovering just above the area, as if expecting the bleeding to resume, but it didn't. The silence, punctuated only by the steady beep of the monitor, affirmed the miracle. He straightened up, turning to face Luz. His gaze was no longer dismissive, no longer arrogant. It was stripped bare, vulnerable, filled with a raw, undeniable respect. He cleared his throat, but no words came. He tried again, his voice hoarse, barely a whisper. "Remarkable, Nurse Garcia," he finally managed, the words carrying the weight of a profound apology, a grudging admiration, and an undeniable acknowledgement of defeat. His tone was stripped of all superiority, replaced by a genuine wonder. Truly, remarkable. The other doctors in the room, initially frozen in their astonishment, now began to stir. Dr. Evans, the vascular surgeon, approached, his eyes scanning the monitors, then the surgical site, then Luz. A slow smile spread across his face, not one of amusement, but of pure, professional admiration. I've never seen anything like it," he murmured, shaking his head. "It defies everything I know. But it worked." Nurse Reynolds, who had seen decades of medical drama unfold, wiped a tear from her eye. She looked at Luz, not as the rookie nurse she'd silently judged, but as a quiet titan. She walked over and gently, almost reverently, squeezed Luz's arm. "You saved her, Luz," she whispered, her voice choked with emotion. "You truly saved her." Luz, her own adrenaline beginning to wane, felt a tremor run through her. The sheer weight of responsibility, the crushing pressure of the last hour, now gave way to an overwhelming surge of relief. Her shoulders, which had been rigid with tension, finally relaxed. A soft, weary smile touched her lips, a reflection of the deep satisfaction that came from pulling a life back from the brink. Zara was stable. The little girl had a chance. And in that moment, for Luz, nothing else mattered. The hierarchy, the dismissiveness, the judgment, it all melted away, leaving only the profound, sacred truth of a life preserved. The usually a sterile, impersonal arena, was now filled with a quiet, palpable hum of human triumph. The quiet hum of the monitors, now reassuringly steady, felt deafening in the aftermath. The collective breath held by the entire surgical team slowly, tremulously, released. Dr. Kovacs, still hunched over Zara, his hands no longer frenzied but resting on the tiny, now stable abdomen, was the first to move. He straightened slowly, his eyes, previously wide with panic and then desperation, now held a bewildered awe. He didn't speak immediately, simply stared at Luz, his brilliant mind struggling to reconcile the quiet nurse with the miracle worker he had just witnessed. The transformation in the room was palpable, thicker than the antiseptic air. The rigid hierarchy that had suffocated Grandview Medical Center for decades seemed to crack and splinter in that single, profound moment. Dr. Anya Sharma, the anesthesiologist, her face streaked with tears of relief, was the first to break the reverent silence after Kovacs. "Luz," she breathed, her voice a fragile whisper, how did you do that?" This was the question hanging in the air, echoing in every stunned gaze turned towards Luz. Residents who had openly scoffed at Kovacs's desperate agreement now stared at her with a mixture of profound respect and genuine bewilderment. Senior nurses, who had seen it all, felt a shiver run down their spines. This wasn't just skill, it was something beyond. It was intuition, an almost artistic grace under unimaginable pressure. Luz, though deeply gratified, felt a familiar warmth creep up her neck at the sudden spotlight. Her eyes, still intensely focused on Zara's vitals on the monitor, only flickered briefly to meet the gazes of her colleagues. "It's a technique," she began, her voice still calm, a stark contrast to the emotional maelstrom in the room. "One I learned where resources were scarce, and vessels were often compromised." Dr. Kovacs, recovering his voice, stepped away from the table, taking off his gloves with deliberate slowness. His face, usually a mask of unshakable confidence, was now etched with a profound humility. He walked to stand directly in front of Luz, his towering figure no longer intimidating, but almost deferential. "Nurse Garcia," he said, his voice surprisingly soft, utterly devoid of its usual arrogance. I have never witnessed such precision. Such gentleness with such urgency." He paused, searching for the right words, his gaze piercing. "Where exactly did you learn to do that? That wasn't in any textbook I've ever seen." Luz took a deep breath. This was it. The part of her life she rarely spoke of, the experiences that had forged her into the quiet, observant person she was. "Before nursing school," she explained, her voice steady, "I was a combat medic. In some of the toughest places on Earth. We learned to improvise, to work with minimal equipment, often on patients with severe, unpredictable trauma. Many times, the most aggressive approach would only worsen the bleeding, tear fragile tissue further." She looked directly at Kovacs, a quiet intensity in her eyes. "You learn to listen to the body, to find the path of least resistance. To be as delicate as possible, even when lives hang by a thread." It was about preserving what little integrity the vessels had left. The revelation hung heavy in the air. Combat medic. The words painted a stark, vivid picture: dusty, chaotic field hospitals, makeshift operating theaters, the relentless pressure of life and death decisions made in moments, not hours. It wasn't just a qualification, it was a testament to who Luz Garcia was. It explained her unwavering calm, her uncanny ability to see beyond the obvious, her quiet strength. It explained the source of her unique, gentle power. She hadn't just learned a technique, she had lived it, honed it in the crucible of absolute necessity and human suffering. Kovacs slowly nodded, a flicker of something akin to shame passing over his features as he recalled his earlier dismissiveness. "Extraordinary," he murmured, more to himself than to her. Then, louder, addressing the entire room, his voice tinged with a raw, uncharacteristic vulnerability, "Nurse Garcia. You just performed a miracle. You saved a child's life where I, the chief of surgery, utterly failed." He extended a gloved hand, not in a handshake, but in a gesture of profound respect. "My deepest apologies for my arrogance. And my deepest gratitude for your unparalleled skill." Luz, though her heart swelled with a quiet, profound sense of validation, simply nodded back. "We all did our part, Dr. Kovacs," she said, her humility shining through. She truly believed it. The team's support, the equipment, the immediate care, it was all part of the chain. Her gaze drifted back to Zara, the little girl who now had a chance. "The important thing is Zara. She's stable." In that moment, surrounded by awe and respect, Luz remained fundamentally herself, a quiet force, driven by the sacred duty of preserving life, untouched by ego, her gaze always fixed on the patient. The transformation wasn't in her, but in how everyone else now saw her. In the days that followed Zara Hussein's miraculous recovery, the ripples of that intense operating room drama spread far beyond the sterile walls of Grandview's or 3. Zara herself, fragile but tenacious, made steady progress. Her parents, who had prepared themselves for the worst, watched with tear-filled gratitude as their daughter, though still facing the challenges of cerebral palsy, began to regain her strength. They saw Luz not just as a nurse, but as a guardian angel, a sentiment echoed by Zara herself, who, with her limited speech, managed to whisper Luz, "friend." It was a profound connection, built in the shadow of death and solidified by the gentle touch of a healer. Zara's survival became a symbol of hope within the hospital, a testament to what could be achieved when dogma gave way to daring. For Dr. Zoltan Kovacs, the consequences were deeply personal and profoundly transformative. The man who had entered the OR as Grandview's reigning surgical titan emerged irrevocably altered. The public accolades for Zara's rescue were, by his insistence, primarily directed at Nurse Garcia. In private, Kovacs began a slow, painful, but ultimately redemptive self-reckoning. He no longer barked orders at nurses but engaged them, asking for their insights, acknowledging their expertise. His initial apology to Luz was not a fleeting gesture, it was the foundation of a new professional ethos. He championed a new hospital initiative for interdisciplinary collaboration, pushing for more training for nurses in advanced procedures, and notably, for the creation of a specialized vascular access team, with Luz Garcia as its de facto, though still humbly unofficial, leader. The rigid hierarchy of Grandview Medical Center, once as unyielding as its marble floors, began to subtly flex. The hushed whispers about Nurse Garcia's miracle grew into open discussions about the invaluable, often overlooked, contributions of all staff members, not just physicians. The incident forced everyone to confront their preconceived notions about where expertise truly resided. Grandview learned that a title does not define skill, and sometimes, the most revolutionary solutions come from the most unexpected corners. There was a palpable shift in the hospital's culture, less about professional rank, more about collective intelligence and shared responsibility. And then there was Luz. The revelation of her combat medic past, though initially a surprise, resonated deeply. It wasn't just that she had saved Zara, it was how she had done it, with improvised ingenuity and a profound respect for the human body's delicate systems, honed in an environment where resources were scarce and lives hung by a thread. Luz remained Luz, quiet, humble, and utterly dedicated to her patients. She didn't seek the spotlight, deflected praise with genuine grace, and continued to approach every task, from changing a bandage to consulting on a complex vascular case, with the same meticulous care. Yet, her world had changed. Her quiet strength was no longer overlooked. Doctors now sought her opinion, not just for her extraordinary vascular knowledge, but for her calm demeanor and pragmatic problem-solving. She was offered promotions, advanced training opportunities, and leadership roles, which she accepted with a practical focus on how they would better serve patients, never for personal gain. She became an informal mentor to younger nurses, inspiring them to trust their instincts and to understand that their hands-on experience offered a perspective often missed by others. She taught them that true power lay not in dominance, but in the gentle art of healing. The story of Luz Garcia and Zara Hussein became a legend at Grandview, a reminder that heroism wasn't always loud or flashy. It was often quiet, steadfast, and deeply compassionate. It proved that human growth wasn't confined to grand gestures but could be found in a humble chief surgeon learning to listen, in a recovering child finding her voice, and in a quiet nurse whose authentic self, once hidden, had finally shone through, forever altering the landscape of an elite medical institution. Hope, Grandview learned, wasn't just a clinical outcome, it was a profound human shift, a renewed belief in the boundless potential within each individual, waiting for the right moment to emerge and heal not just bodies, but souls. Luz's story reminds us that true heroism and profound healing often emerge from the most unexpected places, challenging our perceptions and proving that compassion and skill know no hierarchy. What quiet acts of courage or hidden talents have resonated with you? Share your incredible stories in the comments. If this tale inspired you, please subscribe to become part of our warm, global community. Your support genuinely helps us craft more impactful and heartwarming narratives like this one. We are incredibly grateful for your viewership and for being such a valued part of our journey. Thank you for watching.